Good evening. I'm Jo DeVries. I'm the commissioning editor at Flint Books, and I have been working with Caroline Harris on M-Boldened, menopause conversations we all need to have. And I am delighted to be joined tonight by three of our incredible contributors to the book. So I have with me this evening Dr. Marla Shapiro, who is one of the past presidents of the North American Menopause Society. And in the book, she gives an incredible overview of Canada about menopause and medicine. She's also a professor in the Department of Family and Community Medicine at the University of Toronto. So thank you for joining us, Dr. Shapiro, this evening. I also have with us Dr. Wen Shen, who is Assistant Professor in the Department of Gynecology and Obstetrics at the Johns Hopkins University School of Medicine and the Johns Hopkins School of Nursing. She's also the Director of the Menopause Consultation Service and the Co-Director of the Women's Wellness and Healthy Aging Programme at Johns Hopkins. So thank you for joining us, Dr. Shen. And I have with us Catherine O'Keefe, who is probably better known as AKA the Wellness Warrior.ie, and she is Ireland's first menopause coach and has become such a powerful advocate for menopause training and menopause and mental health awareness throughout Ireland and beyond. So I'm really thrilled to have you all with me this evening. And although the focus of our discussion is going to be on menopause and medicine, I hope that it will touch on many of the multi-layered issues that surround menopause and health and well-being. So to start with, one of the things that Caroline and I were really passionate about with the book was to share as many different experiences of the impacts that menopause has had on physical and mental well-being. And I was wondering whether you might feel comfortable either sharing some of your own experiences or some of the experiences within your practices and your work that you've come across that are either common or sort of particularly impactful in women's lives when they're going through menopause. So I thought, if it's all right, we could start off with Dr. Shapiro today, if that would be all right.
I think that our practices often shape the experiences that we have because our patients know about our own passion about women's health and particularly midlife and aging well. So for the women in my practice, we're always talking along the continuum of life about the changes that can be expected. And those include mental health and well-being, particularly with many times across women's cycle when estrogen changes, particularly in the perimenopause and early menopause, talking about diet, lifestyle, nutrition, and sexuality and wellness in relationships. There's so much to talk about, cardiovascular health. But my main focus in terms of working with women is to empower them and educate them so they're guided by knowledge and not fear. So we come from different countries, but one of the things that we both share is that we're North American, very much have been influenced by the Women's Health Initiative, where those headline news, even though they're decades later, still have women quite fearful about treatment options and had a whole generation of practitioners not being trained in how to have the conversation, offer therapy, support women through this journey, and really partner with them in a meaningful way to help them stay well and to meet the priorities of their wellness.
Yeah, and I think that's a really interesting that you brought up fear, because absolutely, I think that's something that comes out a lot in the book and in the conversations that Caroline and I have had through putting the book together. And it feels like something that, as you said, we're here, we're in 2020, we shouldn't still be having to deal with this level of fear and about our own bodies and understanding, how to look after ourselves, and yet it's still very prevalent. Dr. Shen, is that something that also you've come across in your own practice?
Absolutely. And I think what Dr. Shapiro just summarized, so beautifully, basically, totally correlates with my own experience. And what I found really, really remarkable are when a patient walks in and she is just at her wit's end. She thinks that, you know, she's going crazy, or she's the only one who is experiencing the symptoms that she's experiencing. And it really is very, very helpful to reassure her and to explain that what she's going through is actually quite common, and there are ways that we can help her. I think that, you know, the example I usually give is a poor patient who walked into my office. This was about 10 years ago. And this is literally what she said. She said, "My kids think I'm the meanest mother in the world. My husband is ready to walk out on me because I'm so mean. And then I just screamed at my boss." And after that, I said, "Oh, we need to do something." So, and that's a summary of how a woman can feel. And she's just so desperate. And it's really important for her to know that she doesn't have to suffer with that, and that we can help her.
Yeah.
Women have also, I think, limited themselves in the perception that's bound by risk, or the anecdotes they hear, or what they read, and depending on where they get that information, not recognizing that much of what Dr. Shen and I do is talk to women about individualizing their treatment and individualizing the priorities that they have. And I explain to women that each of us is unique, and what may be good for your neighbor may not necessarily be good for you, or the preconception that this is dangerous. Everybody has their unique health. That is stab we're always giving out is, don't limit yourself by not asking the question. So kudos to this woman who comes in and says, "My husband thinks I'm mean, and my kids think I'm mean. I'm yelled at my boss." To be able to give this descriptor to say, I need something, without necessarily knowing what is going wrong that has made her feel this way.
Yeah.
Exactly.
And I think part of that is it's actually knowing where can you go to get that information. I know one of the challenges that we face in Ireland is that, you know, our GPs, our general practice doctors, they don't get much training at all when they're in college studying in relation to menopause. So a lot of women here are derailed by menopause, and they're actually left in limbo. And it's like, well, where do I go? And then you go, sometimes it's Dr. Google, and obviously that's not the right place to go. They need to be able to, Dr. Shapiro said, you know, it's getting evidence-based factual information that will suit you based on your personal history, and every single one of us is different. And I'm forever saying to women that, you know, no two women in the world will have the same menopause journey, because every single one of us is different. So it means your treatment plan, your treatment protocol is going to have to be different. And certainly in Ireland, we face a lot of issues in relation to fear, as opposed to understanding the facts. And that's one of the areas that I've been doing a lot of work on, is trying to empower women to understand, you know, what's actually, you know, what's mystery versus what's fact. And let's look at the facts, and let's look at what can work for you as an individual woman, as opposed to, you know, it's not your sister, it's not your mom, it's not your best friend, it's your menopause. So the treatment is going to be different. And, you know, I think, Joe, in relation to your question, you know, a lot of the challenges I would see in Ireland that women face, we have a lot of, there's definitely challenges around sexual health in relation to, you know, vaginal atrophy, issues around urinary incontinence. And for us, we've got a bit of a double whammy, in terms of a lot of that isn't openly talked about. And that's something that we're trying to bring more awareness to, you know, even simple things that women become more familiar with their bodies families that they check themselves on a monthly basis, and that then they're able to have a conversation with their GP, because I would often talk to women who actually feel very embarrassed and won't want to have the conversation with their GP, you know, and I'm kind of saying, well, as an icebreaker, just maybe write it on a piece of paper and shimmy it across the desk, and at least, you know, you can start the conversation. Because, you know, as we know, some of those symptoms, they have to be managed, and they have to be managed very closely.
Absolutely. And I think you brought up two interesting themes there that I wanted to kind of pick up on, because they run a lot through the book. And the first one would be about that actual, not only a woman's own lack of knowledge, but also actually the lack of knowledge and training that sits within the healthcare system around menopause. And that's something that came really powerfully through actually everybody that we spoke to across the globe in relation to the book. And I suppose to ask, you know, both, you know, Dr. Shapiro and Dr. Shen, you know, why do you think that still is the case, and what are the practical things that we could do on a kind of systems level to try and actually change that? Because, you know, I think, how are women ever going to have confidence and faith in their practitioners if those practitioners actually, when they come to them, are sort of nonplussed by some of the symptoms that women are talking about?
Yeah, I think traditionally women have been hesitant to bring up the whole subject about menopause because they were embarrassed. And so in the baby boomer generation, which I belong to, we hear from our mothers, well, just, you know, deal with it, just buck up and deal with it. And it then becomes this continuum of silence. And it's only when providers can speak up and ask the patients, and the patients actually then realize that it's okay to talk about it. And I think that it's getting more prevalent now that we can discuss menopause symptoms, and that it is something that is recognized, because traditionally it has not been taught in medical school programs across the US. And it's starting to be more now, because more and more women are menopausal and postmenopausal, and because we're living longer, right? So it's necessary, and we're becoming a majority of, not a majority, but a significant portion of the population. And so you have to deal with us. You have to deal with menopausal women. And we had better be kept healthy. As Marla had said, healthy aging is very, very important, because otherwise, if nothing else, public health-wise, it's a major, major cost for all these postmenopausal women to have all of these medical conditions that, had they been appropriately counseled and managed when they went through menopause transition and early in menopause, maybe could have been avoided.
There's also this conspiracy of silence. I mean, conspiracy is rather a strong word, but often, for example, let's talk about something as basic as vulvovaginal atrophy. We now talk about the phrase genitourinary syndrome of menopause, but all women who are estrogen depleted will eventually have some degree of atrophy. Not all women will suffer. Not all women will seek treatment, but there's often the belief on women's part that this is just a part of aging, because their hot flashes may be over. They may have transitioned through that difficult time of vasomotor instability, and they see this as part of aging and not necessarily part of menopause. They may not bring it up, and your healthcare practitioner doesn't bring it up, which becomes this conspiracy of silence, because if you aren't bringing it up as a patient, a woman, to say, this is an issue for me, and you've got a healthcare practitioner who's like, well, if they're not complaining, I'm not opening up Pandora's box. One of the most important things I teach my residents is the importance of normalizing open statements that aren't offensive, aren't aggressive, and don't humiliate women in any way. So to be able to say that all women who transition through menopause, and women who say to me, oh, am I done my menopause like a doorway? No, you're not done your menopause. You're going to be living in menopause through the rest of your life. This is not a doorway. This is a period of time. Next stop, unfortunately, is death. So you're going to be living in menopause, and so many of our women are spending more of their life in menopause than not, that women will experience or burn. That doesn't mean that you don't have discomfort or dryness or burning or irritation. And there are so many safe and effective treatments and management strategies that we have for you. Is this something that you're noticing? Now, that sort of statement of ubiquity that normalizes it, reassures them, tells them that this is not unusual, they're not alone, and this is a safe place to talk about your sexuality, your vagina with respect and dignity, is something that you actually need to be trained how to do. Because I've walked in and had a resident say, "How's your sex life?" Question that we are asking. That's not dignified, that's not appropriate, and that doesn't empower a woman to feel like this is a safe place where I'm going to get the information that I need.
Yeah, and I think that's an incredibly powerful thing. And I think absolutely that comes down to good role modeling, probably within the healthcare system, more, menopause specialists who are able to role model exactly that kind of questioning and sort of the kind of approach that women need, because these are really difficult and intimate issues for women to discuss. And I was running a talk earlier in the week, and we were talking about flooding being another issue that actually women really struggle to bring up, and some women obviously suffer when they go into perimenopause with flooding, very irregular periods and things like that, and often don't realize that that would have any thing to do with the menopause because they're still bleeding. Then I think there is this sort of sense of, oh well, menopause is only this thing that happens when as soon as my periods stop. Whereas I wonder if we need more education about what are the potentially different, as you say, everyone is unique, but different stages of menopause. And in your experience, when do you end up seeing a woman? Because it sounds a lot like, from the things you're saying, that it's when they get to the point that they're desperate. Do you think that there would be a way that that could be changed so that dynamic in the conversation could be more empowering for women before they get to that point?
I think, Joe, what you're going to hear from Dr. Shen and myself is a similar point of view, that we don't wait until women are a certain age. I'm empowering women from when they're teenagers all the way through to understand their bodies, to feel that this is a place to bring questions, to try and anticipate changes that may happen, but basically to reassure them that the nature of our relationship is that the only dumb question is the question that does not get asked. So any question that you have, any concern that you have, or just point of information, this is a good place to start. And I think that that's what's important about the relationship that you have with your patients. I'm always saying to them, it's not my job to keep you healthy, it's our job to keep you healthy. And our job can only happen if you make sure you're letting me know when I'm not asking something important that's on your agenda and may not be something that I'm not talking about, but it doesn't mean that it's not important or it shouldn't be on my agenda as well.
Yeah. And Catherine,
Right.
I wonder, because probably our experience, I wish I had doctors like Dr. Shen and Dr. Shapiro. I'm not sure whether, your experience of the kind of healthcare system in Ireland would correlate with that, because certainly my own experience of, not to say, I think, we're very lucky. We have an incredible free to access healthcare with some amazing healthcare professionals, but it can be patchy, particularly I think when it comes to women's issues with general practitioners. And I don't know if you'd like to kind of perhaps shed a bit of light on perhaps how that feels, and your experiences of women talking about that relationship.
Yeah, I think, Joe, from our perspective, from Ireland's perspective, patchy is the word. It is very patchy. Now we are fortunate in that more and more GPs are seeking to do additional training outside of their practice in terms of enhancing their menopause knowledge. but we need a lot more of that. And our healthcare system is very different to the UK in terms of your pay, it's paid healthcare. So that can pose a lot of problems for women in terms of, the cost plus the cost of medication and so forth. But really, when it comes down to it, we struggle with the conversations in terms of one of the biggest barriers, as I mentioned earlier, is women feeling comfortable when they go into their GP that they can have a conversation that's treated respectfully. And unfortunately, on numerous occasions, I will hear from women who are told to, well, just either close that chapter, that this is life, move on, or it's kind of, you just have to get on with it. It's, this is menopause. You're just meant to get on with it. And they're not actually given the treatment that they need. And it's also, there's no future proofing of the future health of those women taken into account. So there's a huge amount that needs to be done in Ireland. And whilst the Department of Health have launched a women's task force to look at all areas of women's health, and menopause is part of that, we have a very long road to go, because we struggle, as I think most countries do, in terms of having enough general practice doctors anyway to support the population, and then to find the doctors who have the passion and the training and the experience around menopause there's another gap there, which is slowly being filled, but it's way too slow. And then the problem is those doctors have huge waiting lists, because already people know that they're specialists in menopause, they want to go to them, and then they have extended waiting lists. I think from the perspective of Ireland, ideally, I love what Dr. Shen and Dr. Shapiro are saying in relation to, nurturing that understanding of your body from a teenager's perspective. I mean, that is what it should be. That does not happen here. I mean, you struggle. Not every woman does a breast check. Not every woman looks at her vulva to confirm, how it looks. Not every woman will confirm that she is thrush before she goes off and self-diagnoses and treats herself over the counter with thrush, because she doesn't want the conversation with her GP. She doesn't want to have that conversation. So, we've challenges on many fronts that, we need to try and tackle. And to me, where that's going to start is going to be formal, nationwide, across all society, is education. And that needs to start in the secondary schools. It needs to extend itself out into workplaces, into medical training, into therapist training, into anyone who's working closely with a woman in natural menopause or in early menopause. They need to understand the differences, and how you can help women, because I speak to so many women who unfortunately just are not getting the help that they need, and they're suffering, and a lot of them suffer in silence, and that we need to stop.
Yeah, and I think that is absolutely true. And I think when you said not many women check their vulvas, and I would say probably vast majority don't.
Yeah.
I think that women, and I don't know, I can't speak for the States, I would certainly say in the UK, and so, even of my, most of my, we don't look after our gynecological health. Like it's the very last thing down on the list of priorities. When you've got many other things that you're battling with and thinking about and things like that. Equally, when you were talking, Dr. Shapiro and Dr. Shen, I was thinking, gosh, I wish that was, I would wish that was my experience. I think there's something that also undersits that, and I'd like to come back to the education question, but something that, you speak to quite powerfully in the book, all of you, but it sort of sits with me, particularly Dr. Shen, when you were talking about research and the funding that sits behind research, and how poorly funded women's sexual health, women's health research is generally, but whether or not perhaps this lack of or deficiency in research means that we're not really looking at what some of the impacts this lack of healthcare as we age is actually having, as you said, kind of, both economic and obviously, most importantly, on the women themselves. Would you just want to be able to expand a bit on that and where you feel like we're at with kind of healthcare research for women?
Well, what I have found in my attempts to get funding for the Women's Wellness Program and Healthy Aging Program that I'm doing is that talking about aging medicine is not sexy, and especially with with our youth-focused culture, it's not something that people really want to talk about. And when we talk about getting cardiology, getting psychiatry, getting rheumatology on board, the question that I very often got was, well, why don't you want to get plastics in there? And my response was, yes, once we're up and running, and if we have enough funding, it would be great to get plastics in. But right now, I would like to get the important issues that kill women after 65. I would like to focus on that first. And unfortunately, traditionally, research for women's health have been concentrated on reproductive health. And so we are having more and more women in the post-reproductive years. And so I think with all the awareness that is now being taught out there about menopause, about post-reproductive health, I'm hoping that this will change for the better. And there's nothing more gratifying for me is the time I spend clinic with the GYN residents, as well as I have internal medicine residents that spend time with me in the clinic. And so they come away with an understanding about menopause medicine, that it's not just hot flashes, but that, and the amount of quality of health, quality of life that we can provide to our patients through taking care of them in their menopause years. And so that I find is one of the most gratifying things and important things, is to teach the future generations to keep improving the health care that we provide.
I think also part of this conversation is that if you look at traditional and historical research on cardiovascular disease, the audience was largely male. And we've taken male-driven research and applied it to women, where we clearly understand the nature of the endothelial vessel is not the same in women as it is in men. Cardiovascular disease will often present different stages, particularly once we have our estrogen loss and lose the cardiovascular protection of estrogen, that the presentation of angina in women may be different than men, and the management is different than men. You may have normal angiograms and still have women who are having angina that get completely discarded and not treated because we're taking male-driven data and applying it to women. So it's not just that, women are, men in a skirt. That is not it at all. We are not men in a skirt. Our anatomy is completely different, and the way in which our disease process can be completely different. Look at things like osteoporosis. Most women don't understand much about osteoporosis and the acceleration of bone loss in and around the perimenopause, and the fact that if you fracture a hip, there's a good chance, there's a 1 in 4 chance that you'll be dead within that calendar year, or a 1 in 5 chance that you'll end up in long-term care. Just not the advocacy for women to understand that it's more than aging. It's aging and the loss of estrogen, and that within this phase of life, there are very many disease states that do get accelerated. So, for example, women early on with polycystic ovarian disease and how that may translate into their cardiovascular death. The newer data that we now have, that women in terms of who are early super soakers and hot flashers, in fact, may correlate with more cardiovascular disease, that breast calcifications may be a marker of coronary artery disease. These are gender-specific issues that require research funding and are gender-driven. But as Dr. Shen says, the dollars traditionally have not been there. I think that's changing now. I think that we're raising our voices, and this is, but it's happening because of forums like this and platforms like this, where we have to elevate the conversation into the realm of academics and research, and not minimize this into women with jackets on, jackets off, as if that's some type of cartoon that's worth laughing at. It's not.
Yeah, and I mean, I think, you know, if there's one thing that feels so important to me, having read the book, I came away feeling so angry that, you know, we don't have this funding and this research in place when we're half of the world's population, you know. And as you said, I mean, it was a real eye-opener for me that the profound impacts that hormonal changes had on every part of a woman's body, and as you said, you know, processing of diseases, and I didn't have that awareness, and I felt very angry that that awareness hadn't been there, you know, that that isn't part of our education, you know, as Catherine was saying, that, you know, it's not just enough to educate us that, oh, there's this thing called menopause that one day you might, you know, you're going to go through, but it's far off, so you don't need to think about it. And that feels very much like where education has been, as far as it feels, you know, in terms of my own experience. And I don't know how we kind of change that practically, but I also wonder if there are sort of specific issues that, if there are people out there listening to this, you know, the kind of things that actually women could be doing very practically to help themselves prepare for, or you know, nurture a more healthy approach to their menopause, whether they're not yet in menopause, whether they're sort of the beginnings of perimenopause, menopause, are the things that sit alongside those conversations with our healthcare practitioners, that are more to do with our lifestyle, our diet, you know, that we should be looking at as women, that we're perhaps not aware of because of this paucity of education. Catherine, did you want to start us off with that?
Yeah, because I think that's one of the proposals I've put forward to the Department of Health here, in terms of, you know, that women, and just for a minute, if I talk about natural menopause, that that women have a let's call it an MOT. They have a check-in with their GP at a specific time, and let that be, I kind of think, you know, 44, 45 at the latest, so that they you know, ideally have had education, have had been told earlier in school, and further along the line they'll have learned about menopause. It'll be a lot more normalized in society, and by the time then they go and they have that conversation with their GP, it should be a bit like your first meeting with your GP when you're pregnant. It's like, okay, well, here's what to expect, here's the symptoms maybe you might experience, not everyone will, you might experience one or two of them, you might experience none of them, you might experience all of them, but here they are, and here's the options, here's what you can do. And I think that's a crucial part that is missing. So if we can have a long-term plan where we have that relationship with our doctors, that you have that check-in point, that from there everything stems, and from there, you know, hopefully you already know that, you know, after your childbearing years, if you've had children, that you know that you need to start thinking about menopause, and you need to start preparing your body, so that you're doing the lifestyle choices, having the daily habits that we know will benefit. You know, you have your movement, you have your good food, you're limiting what I call the nutrient robbers, like the caffeine, the alcohol, and smoking, and understanding why you're doing that. Because if you understand why you're doing something, it empowers you more. So, you know, why don't you want to be drinking a can of fizzy drink every day? Because, you know, it's going to take from the health of your bones. You know, it's and that understanding is so important, I think, for everyone, but particularly for women, so that, you know, they're more prepared going into menopause, and it's not a kind of a a rabbit in headlight situation where basically you're struggling with hot flushes, you're struggling with anxiety, brain fog, and you're scrambling to your doctor, because then I'm not saying it's too late, it's never too late, but you can preempt by, you know, having the education beforehand, that, you know, well, if I manage my stress, if I'm eating well, you know, if I'm taking certain things out of my diet, this is all going to help me. And you know, your estrogen, your hormones are going to decline, nothing we can do about that. And then it's looking at, well, you know, how are you and how is your body reacting to that decline? And that's where it comes into the individualized treatment that Dr. Shapiro mentioned earlier, in terms of, you know, each woman needs a personalized plan for them. And you know, I think personally it's so important that women start to think about menopause, for natural menopause, when they're in their early 40s, because I'm certainly seeing, with the women I work with, I'm certainly seeing anxiety, self-esteem and loss of confidence are coming in earlier than 45. I'm starting to see that it trickles in probably from about 43 onwards, and there's a complete gap in terms of realizing that this is the start of perimenopause, you know.
I think that with basically comes down to public health. And if we can get more public health information out to everybody, that women can be aware, I would even say starting in their late 30s, okay? Before they get into their 40s, there are preventive health options that they can adopt that will serve them very well as they become post-reproductive. So this is where I feel that menopause should be a public health topic, in addition to being a women's health issue. And the problem is that in the late 30s and 40s, a lot of women are not taking care of themselves, right? Because those are the 1 to 2 decades where women are raising children, and they have teenagers to deal with, and they have the husband to deal with. And then very often they also have aging parents that they're having to deal with. So that very crucial time, a lot of women are foregoing their own health care, you know, for the benefit of everybody else around them. And so if we can raise a public health awareness for women, that even though they may feel totally fine and that they're not in menopause yet, but this is when you need to start actually taking care of yourselves in order to have this healthy aging and healthy post-reproductive life.
Dr. Shapiro, did you want to add something into that? Because I could see you were going to say something.
No, I think you know that we are all very much, you know, preaching to the choir here, but it's the same way that I say to my patients, you know, when you're on an airplane and they tell you about the oxygen and nobody's listening to what the stewardess is saying, or the flight attendant, to be more politically correct these days, telling you that the oxygen mask comes down, you put it on yourself first, not your child, not your parent, not anyone else you're traveling, and you put it on yourself first, because if you don't have your oxygen on, you can't help somebody else. And really empowering women to recognize that not taking care of themselves is not an act of strength, it's an act of weakness. So being able to say, you know, I don't have the time to do this. No, it's because you're not making it a priority. It's not that you don't have the time, you're not making it a priority. And you have to realize that if you don't prioritize your health and well-being all the way through, you begin to lose your effectiveness as a caregiver or as a supporter or as a worker or whatever it is that you identify yourself as, because most of us are busy working on our work ball and our life ball and our relationship balls, and we don't necessarily look at the me ball, but you can be completely empty and vacuous without recognizing that you have a strong hand in the authorship of what's happening. When I say to women, as you go through perimenopause with the loss of estrogen, mood changes are often related to this loss of estrogen, and that may, get better over time. We do see mood changes. To be able to empower them that lots of what we see is actually based on the science of what's happening to your bodies, but to abandon your ability to say, I'm going to make me a priority, and I'm not going to stop going for my PAPs after I have my babies because it's not important. Well, no, it's still important. And even if we're doing PAPs every 3 years, as we do now in North America, you still need to have the vulva and the vagina looked at, and you still need to have an exam, and you still need to be talking about these important issues. Prioritize your education about your body, yourself, and what you can do to be a better version of you, because you'll be a better version for everybody else around you as well. So it's not an act of strength not to make yourself a priority.
Yeah, I think that's an incredibly powerful thing to say, because I think, you're absolutely right that, I think women are very guilty of putting lots and lots of other things first. And as you said, there is this kind of sandwich year where you're kind of looking after parents, you're looking after potentially children, you're working probably full time, you're at a point where you're trying to potentially accelerate your career, maybe you've had a career break and then feel this pressure that this is that you have this window of time in which to achieve certain things, and therefore you put all of these external pressures upon yourself. If there were sort of specific, and Catherine, you touched on a few of these, I was wondering from Dr. Shen and Dr. Shapiro's experience, if there were specific things that you recommend to your patients, that they need to do, what are they to kind of look after them yourself? What does that actually look like beyond just going and getting your checkups?
So my favorite, to make it simple and quick, is I offer them 3 lifestyle practices that can help with their bones, their heart, and their brain, just as a very quick and dirty advice. So one of them is obviously weight-bearing exercise combined with aerobics, and patients immediately think of fancy things like weight trainers and going to the gym, and I tell them, all you have to do is walk, do power walking. That doesn't cost anything, and that's a great form of weight-bearing and aerobic exercise. And then I ask them to focus on their vitamin D levels, make sure that they're doing that supplement, and that they're eating healthy calcium. And I said, between those 3, they can help keep their heart, bones, and brain healthy, because we don't know a lot about Alzheimer's and dementia, but what we do know is that if you have a healthy heart, a healthy cardiovascular system, that would go a long way towards helping your brain health too. So that is the quick and dirty advice that I give to my patients. And then if they wish, we can go into more detail. But those 3 items should be fairly easy to practice for very busy women.
Yeah. And I think that's invaluable. I hope that everybody who's listening to this takes that away. Also thinking about the people who've listening to this and touching on what we spoke about earlier about research and funding. For each one of you, if there was one element of kind of menopause and how it intersects with other areas of a woman's health or life that you felt needed more funding or research or raising awareness of, what would that be? Like, if you could advocate now, if we had someone listening who could fund this, what would be that one thing that you would really want people to kind of be looking at more?
Can I go on that one first?
Jump in on that, Catherine.
I think for us here in Ireland, I would have to say straight off, it's the pelvic health physio, because in a lot of cases here, GPs won't do a visual, they won't do a physical check of a woman's vagina, vulva area. So where that comes in for us is we have specialized physios here who would concentrate on that. And I think, you know, that for many people that if it's not under the public healthcare system, there can be extensive waiting lists. It can be quite important. But I think that's a fundamental part of menopause that we certainly need to look at and I'm talking from the perspective of Ireland, so that you have that check. That check should be there, you know, after you've had each child, if you're having children, but it certainly needs to be, you know, in your mid to late 30s and on a more regular basis, so that you know how things are functioning properly, that you're familiar with any changes that you may notice in terms of urinary symptoms and so forth, because that's a big issue here. It's a huge issue here. So I think that would probably be my one area if I wanted to tick a box that I'd go chasing.
I think for me, it's about teaching women early on about the importance of all the preventive strategies that they can do. And that includes prevention such as vaccination, the importance of human papilloma vaccines in young women and young men. And in fact, in Canada, we don't have an upper limit of age for women who have abnormal paps, even gone to colposcopy to leap for treatment. We know that even vaccinating them after the fact, there's lots of data that shows that it's never too late to make a difference in terms of prevention or recurrence, even of the same serotypes. To understand the importance of pneumonia vaccination, in midlife, the importance of shingles vaccinations, to understand the importance of being a willing partner in your own health. Osteoporosis, I say to my patients, is a pediatric disease. It starts when we're young kids, but it presents in later life if you don't build your bone mass and your bone foundation. The concept of smoking and alcohol and all the things that we do that necessarily will mean adverse outcomes, not only in terms of menopause, but heart health, brain health. You know, as Dr. Shen was saying, that exercise is one of the most important things that you can do to decrease your risk of dementia. It's one of the things that you can do to decrease your risk of breast cancer. One of the things that you can do to decrease cardiovascular disease, to understand the empowerment of prevention throughout the life cycle, and that it never is too late, even as you're going through perimenopause and menopause, in terms of the incredible actual control you do have over the outcome of your health, that in fact much of what we see is not what we inherit genetically, but it's our environment and our lifestyle, and that in fact you can be quite empowered to change the journey and trajectory of how you're going to live your life. So I think that type of preventive strategy empowerment when it comes to nutrition, exercise, and all those preventions, colonoscopies, mammographies, all of those things that we talk about as reasonable timing intervals are critical for women to know that this is something that they need to be proactive about in terms of knowing what they can do to be that partner in health.
So to summarize what both Dr. Shapiro and Catherine have said is obviously, number one, a concerted public health push to women can do to prevent diseases later on in life. That's one. Two is to improve the education of the medical practitioners and let there be more focus and emphasis on women's health. And so I think the present development of specific residencies in women's health specifically is very helpful because traditionally, as Dr. Shapiro had said, care for women had been based on research done on men. And so now we realize that we need to have more research on women and people who are focused on providing healthcare to women. And then thirdly is a very global concept. And I just think that women need to be valued more. Unfortunately, there are still quite a lot of disrespect to women, even in our own country. I'll just leave it at that. And certain cultures, women are only valued when they're reproductive age. And so I think overall women need to be valued more, and even more so women in the post-reproductive age range. And you know, certain Asian cultures and other cultures that have respect and increased respect for the elderly. And that's something that we don't really have because we're a youth culture here in the United States. So I realize I'm totally off topic, but I think that would go a long way towards helping women through the whole menopause and aging process.
Before I leave you, because I do unfortunately have to leave, I just want to say that one of the things that we haven't focused on, and not to be naive about this, but it's such a limited form and there's so much to talk about, is the fact that obviously the role of your cultural background, your ethnic background, the way that you were raised, and we really haven't talked about social determinants of health, which are so critical in understanding what the basic normative values are in terms of those social determinants, whether it's housing, economics, where you live. That's going to make a big difference in terms of how you prioritize the discussion that we're having, and that for many, this is sort of a discussion that's not high on their agenda because the social determinants of health are more focused on getting food on the table and being able to live in clean, healthy sanitation, public health issues as well. So I think, you know, that it's a luxury to be able to have this conversation, and we don't want to minimize that we're not recognizing that across different societal, cultural, normative values, where you are in terms of your geography and the social determinants of health are going to have a great impact in health overall, and of course, menopause as well.
Yeah, and I'm so glad you said that, because I'm very conscious that it was one of the questions that I wanted to come on to, and I think because we've ended up having such a important and passionate conversation about some of the other areas, but I did want to touch very briefly on kind of some of the issues that arise around the fact that, you know, menopause ends up being viewed slightly as well, this is a one kind of size fits all, and actually absolutely not, you know. And I think that comes out so much in the book, where we talk to women from all around the world whose experiences are very different, and also, you know, the different, as you said, determinants, you know, and potential issues that arise, whether, you know, from different ethnic backgrounds, who may have prevalence to certain symptoms or issues. So one of the things that we touch on is fibroids, and the prevalence potentially of fibroids in Black and Asian women, that I don't think there's been enough of a study around, but how the lack of perhaps understanding about that can impact on. I don't know if that's something that you would like to touch on really briefly, Dr. Shen.
Joe, I'm going to actually have to leave because
I know,
I'm
so sorry.
So I'm so sorry to leave it, but I'm going to leave you with Dr. Shen, who's going to finish up. But it's been such an enlightening conversation. Unfortunately, I'm doing typing for the North American Menopause Society, and if I don't sign on to their platform, I may have my neck sliced. So thank you for including me, and I'm going to say goodbye for now. Bye for now.
Bye.
Thank you.
She is a very busy lady. So I think, to repeat your question with regards to social determinants and different social cultural aspects of research, I think that, yeah, there's no, we find, let me just use menopause as a basis, that with menopause, we know that menopause affects women in different genetic, ethnic differences. There are a lot of different forms of menopause, and a lot of different different types of symptoms and cancers that are more prevalent, and fibroids are more prevalent in certain women versus other ethnic groups. So I think that there's still a lot of research that needs to be done. We definitely don't know enough. And so we need recognition, I think, that this is something that needs to be done more, and women's health needs to be more financed for research.
Absolutely, thank you. Because I think, you know, that it does feel so much like there are these big questions out there, and that, you know, until we have that recognition, and I think that's a really good word to use, and I think comes back to, you know, what you said earlier, which really chimed with me. And you sort of said, oh, actually, I've wandered off topic, but actually I felt it was very much on topic, was that if we don't look at this in an entirely holistic way, with the way in which women are seen in the world and throughout the world, then we can't actually be honest about kind of what the situation is, and we can't necessarily make those changes, because there won't be the funding there if there isn't actually that sense of value about, you know, women's place in society. So actually the two things go very much hand in hand, and I'm really glad that, you know, you talked about that. I'm conscious that, you know, we are coming to the end of our time together, and we've touched on so many things, and I think there are so many things yet that we could have talked about. But as we kind of wrap up this evening's chat, is there anything else that, you know, you both felt you really wanted us to be able to discuss tonight that we haven't covered, and that you would just really briefly like to say something about?
One thing, Joe, that you know, I think needs greater awareness, and I know World Menopause Day this year is obviously dedicated to POI, premature ovarian insufficiency, and that's an area that needs a spotlight. We know menopause is having a moment. It's definitely in the spotlight, certainly in Europe, I think, at the moment. But I work a lot with young women who've POI, and it's an area that needs a lot of awareness. It needs a lot of support. It needs research. You know, it needs, you know, funding globally from various countries in terms of really understanding why it happens, and, you know, the reasons for it, and what can be done to help women, and have, you know, establish a multidisciplinary approach in terms of working with women with POI. And I would also say the same for cancer-induced menopause, because again, it's another different journey, and it's a journey nearly of two, you know, horrendous tornadoes nearly, because you've the cancer aspect, and then you can come out of that, and then you're straight into menopause. And, you know, there's certainly areas that need more awareness. They need, whilst we know and we want more training for at menopause in general, it's imperative that training also spends a good amount of time on the different types of menopause, and that we don't forget how important the other types of menopause are. And I think, particularly from my perspective here, I genuinely feel that POI is on the increase. We don't have any stats in Ireland. We always have to refer to the UK when it comes to facts and figures generally, but I certainly feel it's on the increase. And, you know, it's the way it's trending, it's going to become an issue for all countries, and it's certainly something that I just feel needs more work.
Thank you, and I'm really glad that you brought that up. And I would want to add into you know, menopause induced by cancer, as well as other forms of surgical induced menopause. We have some really powerful, incredibly moving chapters around menopause that has been brought on through surgery for endometriosis as well, and the way in which patients just hadn't been prepared at all for the experiences that they were had, and very much sort of were kind of said, oh well, yes, you know, your periods will stop, and here's some, you know, potentially drugs and things, but nowhere near actually kind of prepared for the fact they were actually going to go through menopause and the many different symptoms of that. So I think yes,
that goes back to, you know, the public health education that Dr. Shen mentioned, because, you know, I've worked with women who have had chemotherapy and so forth, and then they wonder why they're having hot flushes, cold flushes and everything. No one has told them, nobody has told them that they are going to experience menopause, and again that they may experience menopause more than once in their lives. So, you know, it's educating the patient, it's educating the doctors, it's educating the people who are interacting with anyone in those situations, and that's where the multidisciplinary approach, I think, is very, very important.
I agree. That, I think, is the bottom line. We need education of the patients, of the medical providers, of the families of the patients, so that the patient doesn't have to go through a lot of the issues, especially the patients with POI, cancer survivors, so that they have support from all the people around them. And so education is at the bottom of a lot of what we need to do.
And I think that is absolutely the right note to leave this on. I think education and empowerment feel like the things that we need to take away from this. I cannot thank you both enough, and obviously Dr. Shapiro as well in her absence, for the time you have spent and the wisdom you have brought and the passion you brought to this conversation. Thank you very much.
Thank you. Thank you for inviting me.
Thanks for having me on.
Thank you.